Hi, I'm Pete, the Medical Director from Neuromedtec. In this video, I'd like to briefly answer the question, what is neuropuncture? Neuropuncture is a 21st century biomedical neuroscience acupuncture system. It has been developed by Dr. Michael Corradino by incorporating research into the neurophysiological mechanisms of acupuncture and bioelectrical stimulation of specific neural receptors. This modern 21st century approach to acupuncture by no means detracts from the traditional Chinese medical model of acupuncture. It only enhances and helps to reveal the powerful neuromodulating mechanisms that have been witnessed by acupuncturists and their patients throughout the centuries. Neuropuncture enables us to create an evidence-based, clinically reproducible healthcare system that enables us to neuroregulate and neuromodulate and neurorehabilitate your nervous system back into health and well-being. Great, now we have a little understanding of what neuropuncture is. So the next question I'd like to answer is, what is a neuropuncture prescription? One of the key parts of the neuropuncture clinical process is receiving a diagnosis. This can be achieved through referral from a primary physician or specialist care. It may be generated by looking at specialty labs, screening tests, functional neurological assessments, questioning. There are a multitude of ways that we can head towards a diagnosis. The rule is that good diagnosis creates good treatment. If we can understand the neuropathophysiology of a disease, then we can target that specific dysfunctional tissue and rehabilitate it back into health. So a neuropuncture prescription will consist of particular functional neuroanatomical units or regions that we will be targeting with our needles and electrical currents to rehabilitate you back into health. All of the neuropuncture prescriptions are neuroanatomical, evidence-based, clinically reproducible and patented. We have an absolute multitude of different prescriptions for most of the commonly reported diseases that come into our clinics. It's not always the case that we do have a diagnosis, and it's very important to recognise that these prescriptions are based on the pre-existing condition of your health and well-being and the functionality of your nervous system. So although we do use patented prescriptions, we often personalise these for your own health needs. Awesome, we're doing great. We've gone through the questions, what is neuropuncture and what is a neuropuncture prescription? So the next question we want to look into is, what is a neuropuncture dosage? These are the electrical parameters that we use to stimulate your nervous system to neuroregulate, neuromodulate, and neurorehabilitate your nervous system back into health. They're inclusive of several different parameters, but there's three that we need to specifically talk about in the context of being a patient and someone receiving neuropuncture. So the first thing you'll hear us talk about is frequency. So the frequencies can be categorized as low, mid, or high, and they have different sensations that come with them. Low frequencies create a tapping, pulsing, or pounding sensation. A mid-range frequency might create, say, a ant crawling, vibrating sensation or a slight cramping feeling, and high frequencies might create a sense of pressure, a slight tightening or constriction of muscle tissues as an example. The different frequencies target specific different types of neurological tissues and events within the body. So it's a major part of how we influence your nervous system. The second parameter that I think is important for us to be aware of is what we call voltage. And there are specific voltage ranges that we're sort of aiming for within a treatment. So to put it at a simple level, ideally, specifically, we're looking for above perception and comfortable. They are the two key parameters. Ideally, we look towards a comfortable, strong sensation. In that context, strength is something that is absolutely regulated based on the pre-existing state of your nervous system and how you present on the day. So, sometimes you might be in the mood for a slightly stronger stimulation, that's great. Other times, maybe not, and that's also fine. If we get above perception and comfortable, then that's really good. The way that I like to say this is, if you can feel it, so can your brain. The last parameter that I'd like to briefly talk about is time variables. We do use different time variables, and that can be dependent on several different factors. Most of our treatments are somewhere between 20 to 30 minutes long. For some conditions, we may leave you a little bit longer, towards 40 to 45 minutes. And also in some circumstances, we might use a shorter stimulation as well. This is very dependent on the particular condition that we're treating, your age, and the status of your nervous system and health and well-being. So the three main things that we need to think about in the context of a neuropuncture dosage is very simply the frequencies that will be used to target specific neurological events within your nervous system, the strength of the voltage, ideally comfortable, strong. If you can feel it, so can your brain. And then finally, the time variables. Great, we're doing really well. We're coming to the end now of the Neuropuncture Q&A. We've briefly answered the questions, what is neuropuncture, what is a neuropuncture prescription, and a neuropuncture dosage. And so the final question is, what is a neuropuncture treatment plan? So the treatment plan, first of all, is inclusive of the previous two parameters. Once we have a diagnosis, we want to create a prescription of the functional neuroanatomical units or regions that need to be stimulated. The dosage, how we're going to stimulate that with specific electrical frequencies, voltages and time frames. And then finally the plan. And this is inclusive of two main parts. How many treatments you need and the frequency of them. So an example would be a short-term orthopedic case that may be quite simple. Could be something like 3 times a week for 1 week, 2 times a week for 2 weeks, once a week for 2 weeks. Just a short-term plan, not too many treatments, and just bring that simple condition back into balance. At the other end of the spectrum, we might have a more complex plan. Let's say we have an anxiety case with insomnia. We might be saying, look, this is going to need 3 times a week for a month, 2 times a week for a month, once a week for a month for some maintenance at the end. An extensive 3-month treatment plan. These treatment plans are based on the evidence of the gene expressions and neuroplastic changes that take place in the nervous system from bioelectrical stimulation. We do know that there is about a 3 to 5 day metabolism of the specific neurochemical markers that we're targeting. And if we can overlap those treatments, we get significantly better clinical outcomes in a faster time frame, which is what we're looking for, of course. So the treatment plans can be inclusive of the prescriptions that are being used, the types of dosages of electrical currents that are going to go into the body, and then the frequency and time frame of those treatments. The other component is the secondary care. So that might be things like we'll encourage you to, say, do some medical movement therapy, perhaps some meditation or breath work could be involved. There could be the use of nutraceuticals and a naturopathic intervention, and there may also be referrals given out. Maybe we need to go see a chiropractor, have our back clipped. We might need some specialist care with an occupational therapist or some time with a psychotherapist. So suggestions can also be made in the context of looking into other modalities that could be useful as well. There might be, say, dietary advice or sleep hygiene advice added into those treatment plans. The treatment plan is personally designed for the individual. Everyone has different requirements in the context of their prescription and dosage, the frequency and time frame of the treatments, and also their ability to be able to comply with that in the context of your work, your family life, all of those sorts of things. So we try to personally design these treatment plans for your specific needs to rehabilitate your nervous system back into health.